Hello, everyone. How are you doing this morning? Almost time for lunch, right? So I'm just gonna wait a few minutes and then we're gonna get started, okay? Okay. Can you all hear me? Okay. Hello, hello. So this is my first time doing it virtually, so just bear with me. Thank you. Okay. Okay. I'm just gonna wait just a minute, and I'm gonna get started. I'm just waiting for people to join. And it's gonna be a great time to learn new things. So please join with me and stay with me. And if you have any questions at any time, just feel free to ask anything, okay? Let me see. How are you doing this morning? Yes, if you have a friend or someone you want to share this with, please do it. It's for the community, so it's gonna help me. So please share this link, invite your friends or any contacts you have, so they can see this piece of information we're gonna share. Okay. Good. Okay. I'm doing fine. Yes. I was a little bit nervous this morning, but I had my coffee, so I'm fine now. So I'm excited to do this. Yeah, me too. I was very sleepy every morning, so coffee is a good option for me. Let me see. I can't see how many people I have here. Mm, I'm just gonna wait one more minute, and then I'm going to start. Okay. So again, if you have any questions, any comments specific to this topic, which I'm gonna introduce later, or if you have any questions about the agency, please let me know. You can chat you can put any comment, or you can always contact me directly, okay? My contact information, I'll give you that to the end, but you can find it here as well on bhs.org, okay? Okay, so I'm gonna get started. So hello, everyone. I'm excited to be here. So first, my name is Karen Rodriguez. I work for Behavioral Health Solutions of South Texas, which is an agency that provides services and programs to reduce substance abuse. So under this agency, under this Behavioral Health Solutions, there's a program, different programs we have. We have treatment, intervention, prevention, and recovery. So I work under the prevention program, and we do a lot of things, right? Under the prevention programs, we have different services that we provide to the community. So I'm going to start and just provide a little bit of information in each of the services we provide, and then I will talk a little bit more about my topic, okay? So I work for the Prevention Resource Center, which is a program of BHS, as I mentioned. And the Prevention Resource Center, we cover 19 counties of the region. So to begin with, there's 11 PRC or Prevention Resource Centers in Texas. So we are Region 11, we're the last region. So we try to provide information to communities, to organizations, and different agencies in the community about substance use data, right? It is very important for us to provide this information because that's how we get the community involved, and also they can learn what's happening, what's going on with our youth. So it is important for you first to understand what we do and why we do it, right? All this information we get, the data we collect, and then the data we analyze, we report it to the state. So it's an exciting job because we get to see what's going on in our community, right? So all this information, again, we share it with the state, and that's how we get, funding, or how we get to know what we need to work on as a community. So to begin with, I'm going to start just talking a little bit about the different programs we have. As I mentioned, I mentioned the Prevention Research Center, but under prevention, we also have coalitions. BHS works really closely with community coalitions. We have Unidad Coalition, and we work very close with different community stakeholders. We work with parents, we work with youth as well. We work with law enforcement, businesses, and other entities within our community, and we all work together to a common goal, right, which is reducing substance use and making our communities healthier. So it is very important for us to share this information because a lot of the people, they don't know what's going on, right, or they don't know where to go to get these resources. A lot of parents, when we do presentations, they get surprised because they didn't know these services, these coalitions existed. And I think it is very important to share this information. And I mean, we meet one time per month, right? Every month we meet once. So it's very, it feels good to be part of these coalitions within our communities. Also, under the prevention program, we have youth prevention. So all of this program is I like this program a lot because they provide curriculum to students. One of the things they do is they go to the schools, the people that is in charge of this program, they go to the schools, they provide curriculum to students, they talk about substance use and all these negative things or risk factors that will impact the student if they engage in these substances, right? So I think it's very good to do this information, to give this information to them at a short age, right? Because we don't want to do prevention when they're 20 years old. So we start at a very young age. The people that do the youth prevention, they go to the schools, they make sure that kids understand what is substance use and how they can prevent that. They also tell them how to interact with their parents, how to ask questions, where to look for services, right? So I just want to highlight the work we do within our program, and this is only prevention. Remember, we have more programs. We have recovery, we have treatment, we have intervention. So it is an agency, again, that provides different services, and it's important to do this kind of video so the community knows what's going on and the resources we have as a community. So let me, again, sorry, I'm doing this. This is my first time doing this. So we're used to do presentations, right, face to face. So it's very easy for me to ask questions, and people usually participate, and here it's me just talking. So it's weird, but okay, let me continue. So as I was saying, I work for the Prevention Resource Center, right? again, one of the main focus of this program is to collect data. We do data collection on different topics, but we focus on consumption data, right? Alcohol consumption, drugs, the use of drugs, prescription drugs, tobacco, marijuana, all of those substances, we try to get and collect local data that can tell us something about the community. What is going on? What are kids doing in high school and middle school? Are they using any substance? Are they not using any substance? So we try to get that information. One of the sources we use a lot is the Texas School Survey. So that's a survey that it's conducted every 2 years. So we wait until, every 2 years to get that information. Once we have that information, we analyze, we create a way to share the data in a easy way for you to understand, because not a lot of people, they don't like data, or they feel uncomfortable just looking at numbers. So we try to create this tool of information and share that with the community, share that with the parents. A lot of the parents, when we do presentations, they get surprised to understand and to learn that a lot of the youth start to using a substance, I don't know, at 13 years old, right? That's a very young age to engage in alcohol use or any other substance out there. So that's one of the things we do. We try to inform the community, we try to inform the parents, and yeah, just let them know that we're here, we provide these services, and we are a resource for them, right? So within our focus, right, it's data collection. We do also qualitative data, which is, for example, we do focus groups. We try to always, besides the data we collect, which is quantitative data, the numbers, all the numbers we collect, we try to get more sense of those numbers by doing qualitative analysis, qualitative data, right? And that's how we get to compare what the stories of people in the community match or connect with the ones we have in numbers, right? So we do focus groups, we do interviews, informal interviews, and surveys. And I'm going to talk about that really quick. Right now, the Prevention Research Center conducted a survey on vaping. So we are currently working the survey. We closed the survey back in like 2 days ago. But yeah, so we're working on the survey right now. We're trying to get analysis of a good sense of information and feedback from the community. So we want to understand why people or why youth used e-cigarettes. That was the main topic, right? Why people or why youth engage in vaping. Do they know they harm, they cause, people to feel bad or get different illnesses? So all of these, we're hoping to get some information from that survey. And again, that was our goal. This is our project for the year. And we were very excited because it's not only information from Hidalgo County, but it's information, regional information. Because again, we cover 19 counties, so we make sure that, okay, we're gonna do this survey, we're gonna try to share the survey with youth and parents throughout the region. So we're very excited to see what's gonna be, the findings. And of course, again, we're gonna be sharing this information with you all. I don't know when we're gonna have face-to-face presentations again, but if not, we're gonna do it either way, virtually, right? So yeah, I just wanted to highlight that we do have a survey right now that it's being analyzed, and I will be happy to share those results with you as soon as I have them. So for those of you that are interested in data or that are working in a project and you feel that this might be helpful to you, please let me know. Just contact me. My information is, I think it's on the website. If not, I can always, you can always comment on this video and I can give you my information. So another thing we do, I know it's a lot of information, I just have 30 minutes. So I just want to share really quick. I have a copy of the Regional Needs Assessment. So this is a report we do every year, and this is proof that we work very hard. It's a long report, and it contains of course, demographics of the region. And when I say region, it refers to Region 11, which is, again, the 19 counties. So I go county by county and try to provide demographics, right? Employments, socioeconomic status, households, everything that I can get, I put it in here. We also have consumption data, again, alcohol consumption, the use of prescription drugs, tobacco, and other drugs as well. Any trends we see, we try to include them, right? Anything that it's impacting Region 11, we try to put it in this report, and this report, we send it to the state. And I think this is very important because people, I know when we do presentations, we want to emphasize, right? It is important to share data, but this is why we emphasize that a lot, because we want to send that information to the state. We want to make sure they know what are our gaps here in the community and how we can get the funds, right? So for me, it's very important to share this information and to let the state know, hey, we need more services on, I don't know, a service that will benefit families or youth. So that's why we do this. And I think that's why it's important. So I just want to make sure, mention really quick that we also do fact sheets. We create, there's a newsletter going on every quarter. So if you want to know like what events are coming up, or, you know, everything that I'm saying here, you can always visit that website, our newsletter, and get all the facts, all the information. We have these copies of the RNA and the regional handbook online. So if you want to get that copy PDF, right, you can just download it for free, or you can always call me. You can contact me and, hey, Karen, send me a copy. I will be happy to do it, right? So I have some key points here I don't want to forget. So the last thing I want to mention about the PRC is that we do have an EPI work group. And I don't know if a lot of you are familiar with that, but we do a lot of, we connect with different organizations and businesses, entities that will, you know, that we work together to get, again, what strategies we can use to reduce substance use. And when I say substance use, it's not only alcohol, it's any other drugs right now. And for instance, the vaping survey we conducted a few months ago, this was a project that we all came together. And I think it's very important because that's the only way we can get something, right? If all the organizations and communities get together and help us, because this is not only a problem that affects one organization or one person. It's a problem that at the end of the day affects you and affects me. So I think that's why it's very important. Okay, so again, I don't have a chance to read all of the comments here, but if you have any questions or any concerns, just let me know, okay? And I will try my best to answer those questions. So today, I just want to quickly talk about the topic I'm going to be discussing here, which is protective factors in the community and school. I know a lot of you might know, or you know already, what's a protective factor, right? It's something, it's a characteristic that lowers the likelihood of a problem to occur, right? We have risk and protective factors, but today I want to focus on protective factors in the community. And of course, if you have protective factors in the community, you would have them at school as well. They connect each other, right? So with everything that is going on right now, the pandemic and all the stressful situations that a lot of the people are experiencing now, I think it's good to highlight that we still need to pay attention to our youth, right? It's very important to understand that they also feel stress. They also feel that fear we feel as adults, and sometimes they don't cope in the right, I would say not the right way, but they don't know how to cope or how to deal with that situation, so they engage in substance use because of their friends, and because all of these risk factors that exist right in our society. So today I just want to talk a little bit about how we can increase the the protective factors, right? How we can find a way to not focusing on the risk factors and all of these negative things that are out there, but how we can work out with all the positive things we have in the community and how we can increase that for the benefit of the youth, right? So there are some school community protective factors, right? And everything we do and everything we share here, it's evidence-based. So we do research, we try and we work with national organizations that provide that data to us and proves, right, that if students, they are more um, engage in school, they tend to not engage in substance use because that they have that feeling of they belong to the school, right? However, we understand that not all the kids feel that way, right? For some reason or for other reason, they feel they don't belong. So that's why they start engaging in different substances. So our goal here is to talk a little bit about the protective factors and how we can continue doing this the work we do and how to parents how they can continue working with their kids as well. So again, some of the protective factors I was talking about is healthy peer groups. It is very important for youth and especially for parents to get to know what friends do your children have, right? Sometimes we don't pay attention to that. It's, we're busy, we're working, but I think that's a key for them not to engage in these substances. According to the Texas School Survey, 50% of students reported that most of the friends share that they're close to their parents. So I think that's a great protective factor or way to explain it, because if you have friends that are also close to parents, to their own parents, that's a way. And if there is this communication, there's a way so they can always stay in touch and communicate what's going on, right? So again, this information, we get it from the Texas School Survey, and it's different students from the whole region. So it's important to understand that communication between parents and youth, it's important. And also having those peers, those friends that will also, provide that not positivity, but also that good advice when you need it, and not to engage in substance use. We have also found that positive partnering between school and family, it's important. In 2018, almost 50% of students reported that their parents attended the PTA association meetings, right? So again, that's important. Although right now I know we're experiencing difficult times, it's important for parents to keep in touch with their kids' teachers, right? It's sometimes, especially when they're like super young, super like kids, they don't share, they don't want to share what's going on in school or if the way they feel. So it's important to always have that communication with teachers and ask them, even if it's not face to face, virtually, hey, what's going on? Is my kid, doing something that it's not usual? Or you need to ask questions. You need to ask the teacher, because that's the only person that works with your kid like almost all day, right? So they know what's going on. So it's important to maintain that communication always, always. Another protective factor that we want to share here is academic standards. I know this applies more to older youth, for example, high school students, those who have high expectations. They want to go to college. Of course, that's another protective factor right there, because you have a goal, right? You don't want to focus on substance use or engaging in alcohol or all those things. You have a goal, and that's one of the things that matters here. So I think it's important for parents still to talk to their children, to their youth, and always communication is a key. So ask them what are their expectations, if they have any, if they're planning to work, employment. It's another protective factor that prevents them to engage in drugs or any substance. We have also another thing, and I want to mention it because I think it's important. It's not only, I was mentioning that parents need to have this communication with teachers, but also teachers, the expectations that teachers have towards the students, that plays a huge role when it comes to substance use, because you might ask yourself, why does it matter? Well, because honestly, teachers have an impact in the lives of anyone who is going to class. So that's another thing, and that's why we go and present to them, not only parents, but we also try to talk to the teachers. And sometimes in a group, they have a very talented, smart kid, and they pay attention to that kid, right? And all the focus and the school, it's very excited to have that kid. But sometimes we shouldn't forget that we have more youth, more children in the group that also want to learn, but the way they learn, it's different, or it's different, a good word to say. And we all need to understand that and make sure they also get the same attention they need to succeed in life. So that's another protective factor I wanted to share with you, because sometimes we forget and we say it's, oh, my kid doesn't pay attention at school because he's very he just wants to talk with everyone and he's not paying attention. Well, we also need to consider the teacher, right? And is he really paying attention to my kid, or what can we do to really work together and get that communication there, right? So one of the things, and one important last protective factor I want to mention, is the resources that exist in the community. We have different faith-based resources, right, available. It's proven that those who belong to a faith-based community, they tend, or they don't engage in substance use compared to those who don't. Also, after school activities, I think it's important to enroll our children, if they're young, to also understand that stress they can work with that feeling by doing sport, right? Practicing any sport there. So it's information that sometimes we forget, and we're like, okay, what do we do? Like right now in this pandemic, a lot of parents, I'm not a parent, but I have friends that are parents, and they're very, stressed about, my kid is here all day. What do I do? I don't know. And right now, although schools are also doing this virtually, we can always find a way, right? Either if you belong to a church, or if you just go to the park and run and exercise and, feel that, go outside and, look at the sun. It's really, a lot of small things can make a huge difference in the way we feel. So I think it's something to consider always. So, and share this information again. If you're not a parent, always try to share this information to one person that it's a parent, because sometimes they really need the help. They really need to understand, because they don't have time to go and look for a resource or a video, a Facebook Live, and they don't have the time, right? So it's always good to share this information and, be a resource for your community and for the youth here. So with that said, I just want to mention really quick that we have, for those who are interested in data collection, we have a way that you can request data. You can always call me, right? I don't mind if you call me directly to my phone number, my office number, but you can always request data, and that is going to be through our website, PRC11.org. you under that website, you're going to see some links, and there's going to be one that says data. So you're going to click, and it's going to give you a form where you can fill in anything you need. If, of course, if we have it, we'll provide that to you. But if not, I mean, I'll do my best and see what can I do. So that's a way you can request data. And I mean, as soon as I get that form, I will work on the data and I'll provide that to you, right? So that's a way you can request data. You can always share this information. I know for college students, I receive a lot of data requests from them because they're working on their projects and they want, demographics of the community, or even those who are interested in substance use. They want to know more about our community, so they request data. So that's another thing I wanted to mention, that we have that resource there for you, or for any agency. And last, I just want to mention that we're going to have an upcoming event. It's a virtual presentation, and we're going to go over this report. Not all the report, it's just an hour long, but I'm going to try to summarize what we cover in this report and how is that it is beneficial for you all, and for different organizations, businesses, law enforcement, and the health. The healthcare agencies and all that. So please, if you would like to attend, there's a link to register. I will share that with you all. They're going to share that flyer on this on VHS. So if you're interested, you can always register. It's really quick, and it's only an hour long, and it's on May 27th from 12 to 1 p.m. And again, it's a way to share that we're here. We are a resource for the community, and we want the best for you all. We want to share that information we have, and always be here for any organization, any agency that is willing to work with us and collaborate and prevent substance use. So if you have any questions, please feel free to enter the questions here on the chat box. If not, that's all I have for now. Thank you for joining me today. I was very excited to share this piece of information with you all, and I hope you gain a little bit of new information. This video will stay on our website, so if you want to share this video after, please feel free to do it. So thank you so much. I'm going to take a few minutes just to read some of the comments here, and if you have any questions, again, feel free to ask any. Thank you so much. Thank you.